Hi, Mad P.
Hi, Dr. K.
How are you today?
I'm okay.
Okay. It's been a year since I've seen you, so I assume you're here for your annual physical exam?
Yeah.
Okay, great. Let's verify your date of birth for me.
June 2nd, 89.
Right, okay. Do you have any allergies that I should
Penicillin.
be? Okay.
Yeah.
All right, I'm just going to ask you a few questions about your family history. Do you have a family history of hypertension or breathing problems?
Hypertension.
Okay.
Both sides.
Okay, and is this grandparents or parents?
Parents.
Okay. Metabolic disorders?
No.
Okay. When was your last physical exactly?
It was about 2 years ago.
2 years, okay. Great. Anything you'd like to address today in particular?
I've been having headaches in the last month or so.
Okay.
I don't know what could be causing them.
Okay, do they come and go?
Well, they come and go, and they go only after I take some medicine, like ibuprofen.
So ibuprofen does help?
Mm-hmm.
Okay, how often do you get them?
Twice a month, 3 times a month.
Okay, all right. Any particular time of day or any activity you do beforehand that might...
In the morning.
Okay, all right, the morning headache.
Yeah, I wake up with a headache.
Okay, does coffee help the pain or?
Sometimes, but not always.
All right. Is it a stabbing pain or a throbbing or?
It's a dull throbbing.
Dull throbbing. All right, great. Any medications on a daily basis that you take?
No.
No? Okay. Any diets that you have that you're on?
No.
All right. Blurry vision?
No.
Changes in taste or smell?
No.
Okay. And what about your sleep pattern? How many hours of sleep do you get a night?
I try to hit about 8 hours per night, every night. Yeah, plus or minus.
Very good. Okay. Do you exercise?
I do.
Very good. How often?
3 times a week at least.
Okay.
45 minutes.
Great. Is this walking, running, just?
I do walk like almost every single day.
That's really good.
I run twice a week, and then I do intensity workouts 3 times a week.
Fantastic. All right. Surgeries in the last 24 months?
No.
Accidents? Have you had a fall, like where you hit your head?
No.
Okay. Right. I'm going to start with some vitals. I'm going to get your blood pressure and grab your oxygenation as well.
I think kids are back in school, so it's not so noisy.
That's okay. Can I use this arm? Yes. Make sure your legs are completely uncrossed. Thank you. Okay. It's 130/90, so it's a little bit high. Did you have coffee before you came in this morning?
A little bit.
Okay.
But that definitely triggered my headache.
You think it triggered it?
Yeah.
Okay. Sometimes that can affect blood pressure readings, so you weren't too much out of range to where I'm worried. All right, 98.1. And let me go ahead and get your oxygenation. Okay. Okay, 82 beats per minute and 96% at room air, so that's pretty good. Okay. I'm going to go ahead and look in your mouth now, so if you could give me an ah. Very good. Tonsils are pink and moist. Healthy gums. I don't see any signs of dehydration. So you look good here. I'm going to take a sample. Okay, just open your mouth for me. I'm just going to take a cheek swab here, testing for certain viruses and cultures. Okay. Go ahead and look straight at me. I'm looking at your pupil dilation. Okay, round and reactive. Excellent. Okay. Now I want you to look at me and follow my fingers. Follow this finger. Okay, now follow this one. Great, all right. And which fingers are moving? The ones on your left or your right?
Left.
Good.
Right. Left. Right. Left. Right.
All right, good. Let me know when my fingers enter your field of vision. Just say now.
Now.
Okay.
Now. Now.
Okay.
Now.
Excellent. I'm going to take a look inside your eyes. So again, look straight ahead for me. Okay. Excellent. Pupils look healthy. Don't see any jaundice or redness. Okay. Okay. Same thing here. Okay, I'm going to take a closer inspection at your bottom lid, so just look up for me. Okay. Excellent. When's the last time you had an eye exam?
5 years ago.
Okay. How's your vision lately?
I think it's okay.
Okay. Go ahead and hold this Allen chart at arm's length for me. Good. Can you read this row here?
FBH.
Good. What about this row?
OLCF.
Okay. Can you read it backwards?
FCLO.
Okay. What about the second to last row?
CFDHJ.
Great. And the last row?
LTFPH.
Very good. Okay. What color is this here?
Red.
What color is this?
Green.
Good. And is this number 8 or number 6? Is number 8 larger or smaller than number 6?
Larger.
Okay. And is number 6 larger or smaller than number 7?
Smaller.
Very good. Okay. Great. Okay. I'm going to be looking inside your ears. So. Okay. Tympanic membrane is pearl gray. I don't see any scarring or signs of damage here. You have a little bit of wax buildup, but not too much. Okay, good. Okay. Same here. You have a bit more wax buildup on the right ear. So I can send you home with a wax cleaning kit today if you're interested in that. Might just help you hear better. But I don't see any visible signs of damage. So, really good. I have a solution. I'm just going to be cleaning the outer ear. Okay. Okay. Excellent. Switch to the other ear now. Okay. This is just to help prevent infection and bacteria buildup. All right, very good. Okay, I'm just going to listen to your heart and your lungs next. So first I'm going to listen to your chest. Just breathe normally. Listening for signs of congestion or irregular breathing. Don't hear anything to be concerned with. Okay, I'm going to listen to your heart. Just keep breathing normally. Make sure your legs are uncrossed. Okay. All right, only S1 and S2 present. I'm going to listen on the bell side. Okay, no S3. Heart sounds normal. I'm going to listen to your lungs so that I can just get onto your sides. Now take a few deep breaths for me. Good. Okay, one more. Okay, listening on the other side, same thing. A few deep breaths. Okay, one more. Okay. All right. Okay. Next, I'm going to have you lay down on the bed. I'm going to do some further inspections on your hair and your scalp, okay? Okay, Mad P, I'm going to just start by palpating your face, okay? So just relax. I'm feeling for edema, swelling. Going to be feeling the sinus cavities. Any pain here? Okay. Pain here as I go out towards the ear?
No.
Okay. Lymph nodes are non-palpable. Okay. I'll feel your lips here. Very good. Okay, open and close your mouth. Okay. Any pain?
A little bit on the right side.
Okay, is that a persistent pain? Okay, how long have you had that?
Oh, for about 2 years.
If you're interested, I can refer you to a TMJ specialist. There are a few different forms of treatment for that, including surgery, but also I find that physical therapy has personally helped me in my TMJ journey, so I can definitely write you a referral. Okay, go ahead and try to lift your eyebrows for me. Okay, good. Now keep them lifted. Try to lower them. All right, very good. Now try to turn your head to the right. Okay, other way. Okay, try to touch your chin to your chest. All right, now lift your head upwards towards me. All right, excellent. Okay. Gonna just be percussing the face. And let me know if you feel any pain. Okay, I'm going to palpate your thyroid. Okay, good. Feels normal. Okay. If you could lift your head, I'm just going to be palpating the back of your head. I just want to feel. Go ahead and rest your head on my. Yeah. Okay, very good. So I'm going to do a smell and taste test. Okay. This is a certain taste that you're going to sense. Go ahead and open your mouth. What does that taste like?
Cinnamon.
Cinnamon, very good. Okay. And I'll be giving you two different scents to smell. They're not too easy, so if you get it in the ballpark area, that's just fine. Go ahead and inhale. What does that smell like?
Lavender.
Yes, very good. Perfect. Okay. Okay. Go ahead and smell.
Lemon.
Okay. There was bergamot, but bergamot resembles very closely to lemon, so I think you're very much intact there. All right. I'm going to do some measurements of the head, so just stay still where you are. Okay. Sorry. Inches. 60. Here. Okay. And it's roughly symmetric. If you could lift your head, I'm just going to measure the circumference. Okay, go ahead and rest it. Okay, 19 and a half. Thank you. Okay. Good. So next I'm just going to be inspecting the hairline. So again, if you could lift your head. Thank you. Okay. Just going to be looking for lice, any signs of irritation. Looks healthy to me. Any scalp issues that you'd like to address? I see some dandruff, but very, very mild. So it probably is just a winter thing. Okay. Okay. I'm going to do a sensitivity test. Okay. So do you feel this as a cold sensation?
Yes.
Okay. Does this feel warm to you?
Yes.
Okay. Say warm or cold depending on which one you feel.
Cold.
Good.
Warm. Cold. 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 Warm. Cold. 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 Warm. Warm. Cold. 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 Warm. Warm. Cold. 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 Warm.
Okay. Go ahead and lay face up. So I'm going to be making a vibrational pressure with this tuning fork, placing it on different prominences of the skull. You're going to feel a vibration sensation. You're also going to hear it. Let me know when the feeling and the sound stops for you, okay? Just say now.
Now.
Good.
Now.
Good. Okay. 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 I'm going to be humming a simple note. Let me know when the humming stops for you, okay? Okay, very good. So, everything is turning out normal so far. I'm going to move on to the abdominal exam, okay? All right, so just relax, P. I'm going to be palpating your stomach, okay? Just feeling for your organs, looking for any signs of hardness or enlargement of the organs. And let me know if you feel any pain too. Okay. Okay, I'm going to go a little bit lower just to feel your lymph nodes. Non-palpable here. Very good. Okay, I'm not too concerned with that. I'm just going to take a listen. So you're going to feel the coolness of my stethoscope. Okay. Getting some pretty loud acidity buildup. Did you drink coffee this morning without food? Okay, that's probably why. No gastrointestinal issues that you've had? Okay, good. Mm-hmm. Okay. Doing some percussions here. Okay, that's normal. All right, taking some measurements. 11 inches here. Radius. Here to the 4 inches. So good. As well. Okay. Perfect. Going to be doing a pressure point test. This is a sensitivity test to look for any neurological issues that you might be having. So this is going to be 1 pressure point, and this will be 2. Let me know if you feel 1 or 2 points, okay? Okay, you had some discrepancies there, so just going to double check here. This is a cold sensation, and my finger's going to be warm. So say cold or warm. Okay. Good. Mm-hmm. Okay, very good. I'm going to move on to your feet, okay? I'm just going to do Babinski response test and make sure that your feet look healthy to me. Okay, I'm just going to take an assessment of your feet. Okay, they look very healthy to me. Don't see any issues. I'm going to feel for edema. Any foot pain that you've been having?
No.
Okay. Okay. Just a sensitivity test. Which foot am I squeezing, your left or your right?
Left. Right. Right. Both.
Okay, good. And I'm going to do a Babinski response test. Okay. Nice, okay. And as I draw this sharp object from your heel to the pads of your feet, let me know if you feel it all the way.
Yes.
Okay. And do you feel it on all toes as I bring it down the line of your toes?
Yes.
Okay, let's do the other foot. So let me know again if you feel it all the way up.
Yes.
Okay.
Yes.
Okay, very good. Just going to do another tuning fork exercise, so let me know when the sound stops for you.
Yes.
Okay.
Stopped. Now.
Okay.
Now. Now.
Good.
Now. Now.
All right, very good. Okay. I'm going to have you sit up and we're going to talk about the results, okay?
Okay.
All right, so this concludes our exam today. Everything turned out pretty normal. You had slightly high blood pressure. Your stomach regurgitation sounds were a little bit active, but I think all of that is explainable with the coffee that you had and your morning routine. I am going to refer you to get a CT scan and make sure that your headaches are not being caused by anything major. I don't think they are. I'm going to send you home with the earwax kit that I mentioned, and I'm going to just ask that you maybe lay off the coffee for a while or slightly reduce your coffee intake. I think that's going to help with your headaches and also just help with your overall health. How many cups of coffee do you drink a day?
About 4.
4? Okay, that's a lot. So I would try to reduce to maybe, to be realistic, 3, then the next week 2, and try to get it down to 1 a day. I think that will be more healthy. It's going to make you feel more hydrated and help your skin too. Your skin looks beautiful, but you know, just preventative things for down the line. Okay, so do you have any questions?
No.
Okay, great. Thanks for allowing me to do this exam, and have a great year. I'll see you next year
Thank you.
if no other problems arise. All right. Bye. And when was your last head-to-toe exam?
About a year and a half ago, so I'm due for one.
Okay, definitely. When was your last eye exam?
More than 2 years ago.
Okay. Okay. Do you have any complaints today?
I've had some headaches recently. They come and go, especially at night.
Okay, all right. And so how long has this been going on?
On and off for about 2 months.
Okay. Any change in diet or lifestyle that you're aware of?
I stopped eating dairy recently to see if that improves my sleep.
Sure.
Because I also have trouble falling asleep at night. I'm not sure if they're related or not, but that's a major change.
Okay.
Other than that, nothing else that should be contributing to this now.
Any other dietary restrictions that you have?
No, I'm not allergic to anything, just stopping dairy.
No known allergies?
No.
And have you been taking anything to help you sleep or to stop the headaches?
I'm taking magnesium
Okay.
as well as melatonin, but Not every night because I have intense dreams from the melatonin.
Okay. Are you interested in medication to sleep, or are you wanting to go more the natural route?
What would you recommend?
For natural remedies, I would say valerian root. Definitely look into valerian and chamomile tea. Chamomile in any form can be really good for sleep. Also peppermint. I know that sometimes those things can not be as strong as we'd like. So if you are hesitant to try prescription medication, we can start you on that. And then if things don't get better, then we can look into other options.
Okay.
Okay.
I'll give those a try before medication.
Absolutely, yes. And do you have any other concerns aside from the headache and lack of sleep?
I've also had a sharp abdominal pain that comes and goes.
Okay.
I'm not sure if it's related to the headache,
Okay.
but it definitely makes it harder to fall asleep at night.
Absolutely. So it comes and goes, and so you think it's completely random?
Maybe because of the dairy. Maybe
Okay. All right. That could be a
coming off
possibility.
of dairy could be a side effect of that.
Absolutely. Is it a sharp pain?
Yeah.
Okay.
Right here.
All right. And is it anything with the skin or external, or do you think it's all internal?
I've not noticed anything on the skin, but I've also not really paid attention. So
Okay.
maybe you could check that out too.
Sure. Any nausea?
A little bit in the morning.
Okay. In the morning. Any chance that you are pregnant?
No.
Okay. I'm just going to ask a few questions about your family history.
Okay.
Do you have any history of hypertension or blood disorders?
No, I don't think so.
Okay. Lung disorders?
No.
Okay. Diabetes?
No.
No. Okay. Liver problems?
No.
Okay.
My family is pretty healthy,
Okay.
I'd say.
All right. Then is there anything else I should be aware of that would run in your family? Skin problems?
No, I don't think so. My mom also suffers sometimes from trouble falling asleep, so
Okay.
that's the only thing that I'd say runs in the family that I've noticed. But other than that, they're pretty healthy.
It's a very common issue to have, but it can be debilitating if you don't find ways to treat it effectively. So hopefully we can get you on the right track. So for now, I want you to get on the bed, and I'll start by taking a look at your vitals. Okay? All right. So I'm going to listen to your heart and your lungs and your blood pressure. Okay. Okay. So, first I want you to go ahead and breathe normally for me. Okay, good. Only S1 and S2 are present, no S3. Heart rate sounds normal. Going to listen on the bell side. Okay. No murmurs. Great. And I'll listen to your lungs now. If you could take a deep breath in for me. And out. Okay, deep breath in. And out, and then 2 more deep breaths. Okay, good. All right, and relax. Your lungs sound perfectly healthy. Are you a smoker?
No,
Any
that's
history of smoking?
my parents, yes.
Okay.
Smoked.
Okay.
Not anymore, though.
Okay, that's a good thing. Really good. All sounds are clear. So, do you have an arm preference?
Whichever I am.
I'll go ahead and use this one. Okay. make sure your legs are uncrossed. Okay. That's 122/80, so perfectly normal. Okay. Go ahead and slide that off. Whoops. Okay, can I have your index finger? We'll go ahead and see your oxygenation. Okay, hold that there. All right. And this looks excellent. Your heart rate is 82 beats per minute. Oxygenation is 98% at room air. So your vitals are all looking really good. I'm going to go ahead and just move on to do a quick cranial nerve assessment, okay? Okay. Just going to look at the texture of your skin. It's very normally perfused. No excessive milia. I'm seeing very little sun damage, so very good. Skin is not excessively oily or dry. It just seems to be very healthy. So that's good. You do have a little bit of freckling, but nothing aside from that. Okay. I'm just going to check the nerves of your face. If you could puff up your cheeks for me. I'm going to try to close them. Good. Now keep them normal. Try to puff them up for me. Okay, very good. Now I'm going to apply some pressure to the bridge of your nose. Try to turn your head to your left.
Okay.
Okay, good. And the other way. Very good. I'm just going to be testing the strength of your cervical spine, so try to look up at the ceiling for me. Alright, now touch your chin to your chest. Very good. Raise your eyebrows. Okay, frown for me. Smile, show me all your teeth. Okay, and frown. Okay, everything looks really good there. So keep your eyes closed, and you're going to feel a cool sensation. Let me know which side of your face you feel it on, the left or the right.
Left. Right. 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 Center.
Good.
Left. Left. Center again. Left. Right.
Very good. Okay. So I'm going to give you two sensations. 1 and 2. Do you feel the difference?
Yes.
Okay, so this is going to be a soft sensation, and this will be sharp. Go ahead and say soft or sharp.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp.
Very good. Okay. So, you don't seem to have any neurological issues in the face. I'm going to test your smell and your taste now. So keep your eyes closed, and I'm going to give you a few options to taste. Go ahead and let me know. This is the testing paper, so open, close, open. What did that taste like to you?
Slightly bitter.
Bitter taste. Okay. Okay, test paper 2. Open, close, open. What does that taste like to you?
That's sweet.
Yes, very good. Just a couple more. Okay, open, close, open. Okay. What does it taste like to you?
Sour.
Okay. And one more. 3.
That tastes like chocolate.
Okay.
Very sweet.
All right. So you got most of them right. The one you said was bitter was supposed to be just a testing paper. And the chocolate one was actually strawberries, but it was still sweet. I'm not too concerned, but we're going to definitely keep tabs on that next time you come in. Let's take a look at your smell. Okay. What does it smell like to you? Inhale.
Cinnamon.
Yes. Perfect.
Cinnamon, yeah.
Mm-hmm. All right. This one, inhale.
That one is coffee.
Coffee. Very good. Okay. Smell.
I think that's pine wood.
Oh, what?
Pine wood.
Pine wind?
Pine wood.
Oh, pine wood. Okay. Yes. It was pine wood. Yes. Very good. And one more.
That's lemon balm.
Yes. Excellent. Okay. All right, I'm going to do some reflex tapping now. Just to make sure that there's no swelling that I missed. Okay. Your lymph nodes are non-palpable. Your preauriculars and your post, so that's good. Not too concerned there. Do you wear contacts or glasses?
I wear contacts. Yes.
Okay. When's the last time you had an eye exam?
2 years ago, I think.
Okay. How do you like your prescription?
I'm pretty happy too.
Okay. Let's go ahead and check and make sure it's all good. Okay, go ahead and look straight ahead for me. Okay, very healthy optic nerve. No excess veinage, no jaundice. Your pupils are constricting appropriately to light. Very good. Go ahead and look to your left, look to your right, up and down. Good. Okay, same here. Okay, I'm not seeing any issues, no excess tears, no dryness of the eyes, and your pupils are constricting naturally. Go ahead and look up, look down, to your left, and to your right. Very good. So let me know when my fingers enter your field of vision, okay? Say now.
Now. Now. Now.
Good. Now let me know which fingers are moving, the fingers on your left or your right.
Right.
Good.
Left. Both. Both. Left. Right. Both.
Good. Okay. And go ahead and hold this Snellen chart at arm's length for me. And could you read this third row?
FBH.
Good. And the second to last row?
CFDHJ.
Okay. And this row opposite, so starting with the H.
HBFDL.
Good. And what color is this?
Green.
Color is this?
Red.
Very good. And which circle is larger on the chart? Number 7 or number 4?
Number 7.
Mm-hmm. Number 3 or number 2?
Number 3.
Number 9 or number 6?
Number 9.
Okay, very good. I'm pretty happy with your vision and your eyes look beautiful, so I'm going to move on and just look in your ears now. Okay. Do you have any hearing issues?
Sometimes I do hear a loud sound at night.
Okay.
Kind of wakes me up, but I don't know if it's because I'm dreaming or because my ears are actually making that sound.
Yeah.
But I do kind of wake up scared from
Does
that.
it sound internal, or is there someone in the house?
It sounds internal.
Okay. All right. That is very interesting. I'm going to look into that for sure.
Okay, thank you.
Okay. Go ahead and look straight ahead. Okay. Your ears are completely wax-free, which is good. I'm able to visualize the tympanic membrane. It's a little bit wider than what I'd like to see. We like to see a pearl gray, and this is kind of a beige to me, which could indicate some damage to the tympanic membrane. I don't see any signs of infection, so there's no inflammation present, just a little bit different in color. I'm going to check the other side. Okay. This one looks to be completely healthy. It's a pearl gray. Same thing here, same amount of wax, very little. No scarring or scratching, no signs of infection. Okay. I have some eardrops I'm going to send you home with that I think is going to help that left ear. And we'll see if that improves it for now. Don't let me forget that before you leave. I'm going to do some hearing tests though. So you could close your eyes. Let me know which ear you hear the rustling in, your left or your right.
Right.
Okay.
Left. Left. Right. Both of them.
Okay. And let me know when this sound stops. You're going to hear kind of a buzzing sound. Say now when it stops.
Now. 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 Now.
You're going to hear a rustling sensation again. Let me know if you hear it once, twice, or 3 times.
2. 1. 3.
Good. And which sounds further away? Option A or option B? This is B.
B is further.
Good. This is A. This is B.
A is further.
Very good. Okay. So I'm pretty happy with what we've done with your cranial nerve assessment, except for your ear, which I'm going to take note of for sure. All right, so I'm going to have you go ahead and put on a gown just so I can assess the rest of your body, okay? You're going to be laying down face up. Okay. Okay. And before we move on to your abdomen, I'm just going to take a look at your hair to make sure it's healthy. So just relax. You can close your eyes. I'm just going to be making a part and taking a look at how the scalp looks. Okay. Right. Seeing no issues here. Do you ever have any itching of the scalp
A little bit at night.
at nighttime?
Yeah.
Seems like that's when a lot of your issues occur. Which could mean that you might be having some issues with your circadian rhythm. Sometimes the body has a hard time adjusting to a sleep cycle. Seeing a tiny bit of redness. I'm going to just do a quick test. Okay. So this is a wet or a dry test. Let me know if you feel a wet sensation or a dry sensation.
Wet.
Okay.
Dry. Wet. 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 Dry.
Okay.
Dry. Wet. 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 Dry. Dry. Wet.
Okay. So just judging from the part and what I see on the hairline, I'm seeing some mild irritation, and it probably is something that persists throughout the day, but once you lay down to sleep, you notice it more because you don't have as many distractions. I'm going to spray conditioning treatment on the hair, and you'll let me know by the end of the exam if it's starting to feel better, okay?
Okay.
And I'm going to apply just a little bit of cleanser just to prevent infection. Okay. Just going to be dabbing it a little bit along the part. And we'll take a look at that later and see if it improves. Okay. Any burning sensation?
No, it feels quite good.
Very glad to hear that. Okay. I'm going to make note of that in your chart, but for now, let's move on to your abdominal exam. All right. And do you mind if I unbutton just the first few buttons of your gown?
No,
So I
go
can
ahead.
just get a better look to visualize the abdomen. Okay, very good. Mind if I lower these just a little bit? Excellent. All right, so first I'm going to be listening for any abnormal sounds. breathe normally for me. Some normal gurgling, nothing too out of the range of sounds we usually like to hear. And I forgot if you mentioned if you're a coffee drinker.
Yeah, I am a coffee drinker.
Okay, how many cups a day?
Maximum 2.
2? All right. Coffee can be very healthy for things like liver regulation and also general inflammation. So 2 cups does not bother me at all. As long as it's been working for you, that's what's important. Okay.
All right.
I'm going to be palpating your abdomen now. You're going to feel a light pressure, just feeling things like your liver, your spleen, that your organs are normal in size. Nothing is hardened or enlarged. Let me know if you feel any sharp pains. Everything feels normal. I'm going to feel your lymph nodes. Non-palpable, very healthy. Very cutesy, very demure. All right. Okay. Any pain when I did that?
Maybe a little bit on the left side.
Okay.
Very dull though.
Okay. Is that the part where you've been having the sensation? Okay. I'm gonna give you a warm or cold sensation. So this will be cold. This will be warm. This will be cold. Okay. Say warm or cold.
Cold.
Okay.
Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm.
Okay. Very good. I'm seeing a little bit of inflammation on the side, so I'm going to apply some cream. I think that might help some of the pain that you've been having. We're just going to go ahead and see if the topical approach is good. So it's going to feel cold. I'm going to apply it very gently, and then we'll see. Okay. No burning sensation there?
No.
It's all pretty normal.
Feels very good actually.
Good. It's kind of like a massage as well. So hopefully this helps the blood flow to oxygenate better and maybe aid in some of the digestion issues. Okay. Okay, we'll let that sit there. And I'm just going to be feeling your legs for swelling, pain here.
No.
Okay, and I'm squeezing on your knees. Do you feel that pressure equally on both sides?
Yes.
Good. What about here?
Yep.
Good. And here?
Yes, equal.
Okay. And here?
Same sensation.
Okay, good. All right. I'm just going to take a look at your feet real quick. Okay. Go ahead and try to push against my pressure here. Good. Now try to bring your toes up towards yourself. Go against my push. Good. Try to bring your feet in towards each other. Good. And spread your legs if you can. Very good. Okay. So I'm going to be squeezing either your right foot or your left foot. Let me know which one you feel sensation on.
Right. Left. Right. Left. Both.
Okay. Now am I squeezing the heels of your feet or the pads?
Heel. Heel again. Pad. Right pad. Left pad. Both of them.
Very good. Kind of take a look at your Babinski response. You don't have to do anything. I'll be applying a pressure and it should elicit a response. Very good. Excellent. Okay. So now I'm going to have you sit up so I can take a look at your back and then we'll be finished, okay?
Okay.
Okay. So I'm going to go ahead and unbutton your gown with your permission. Just put it to the side. Okay, here we go. All right, so your back looks pretty healthy to me. Just going to be looking here for any lumps or protrusions. Okay, and not feeling anything abnormal. Okay, you do have a knot here on this right side. Definitely a muscle mass, which just means you've been holding a lot of tension, I see, and issues with tension in the back can translate to other parts of the body, so that could even explain some of the stomach pain you've been having. The internal structure of your organs are all connected, and when one thing is off, it definitely can cause strain in other areas. Just going to do some percussions here. Okay. Definitely a lot of strain. I'm going to be gently applying some pressure to that area just to help circulate the muscles and kind of de-escalate some of that tension. Let me know if it gets to be too much. Okay. I'm going to do a couple sensory tests. Let me know if you feel this brushing sensation on the left side of your back or the right.
Left, right, right, left, left, right, right, middle, 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 right, 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 left, middle, left, right.
Good. You're going to feel a puff of air. Let me know if you feel it once, twice, or 3 times on your back, okay?
Twice, one, 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 one.
Good. Just to complete some of this therapy here, I'm going to apply some more of that anti-inflammatory ointment to the back, okay? Just going to feel very cool, kind of like herbal and kind of warm and cold at the same time, okay? Should feel very good.
Okay.
Okay. And gently pulling the skin around the area to help with that circulation. This should not feel painful. It should just feel like a pressure release. It should not feel like a pinch. Okay. Okay. Okay, go ahead and I'm going to have you put your shirt back on and we can talk about the results, okay? Okay, Luna, so you're in really great shape. I really hope that the valerian root and chamomile tea can help you. Also meditation. I know these are all things that you've probably heard a million times, but if you commit to them for a couple weeks, let me know if anything has changed. And if not, we can go ahead down the medication route. It is really important to get a good night's sleep, and there's no shame in using aid if you can. I am going to give you ear drops to also use for a week to maybe help with that sound in your ear, maybe improve the condition of your tympanic membrane. It just looks a little dry and pale to me. And let me know if your stomach improves with this ointment that I applied. I'm going to send you home with some of that as well.
Sounds great.
And if it doesn't get better, we can go ahead and do some imaging, do an MRI. Absolutely. So, do you have any questions for me?
No, thank you so much, Dr. Katie.
Yes, it was a pleasure doing this exam on you, and I hope to see you again in a year. And just keep up the good work with having a healthy lifestyle, and I'll see you again soon.
Good, thank you.
All right. Hi, Ivy. How are you?
I'm good. How are you, Dr. Katie?
I'm very good. It's been a while since I've seen you.
Yeah.
So I know you're here for your annual head-to-toe assessment.
Right.
Do you have any specific concerns today?
No, I think I'm actually doing a lot better than last year.
Okay, great.
Just anxiety is a lot lower. Stress, I feel it a lot lower. So
Amazing.
in general, I feel a lot better.
We talked about some meditation techniques and ways to reduce stress, like listening to, you mentioned you like ASMR, and just being more mindful. So
Yeah, it's definitely been working, and I feel a lot better.
I'm very glad to hear that. Okay, well, since it is been a while since I've seen you, I'm just going to update your family history and ask you a series of questions.
Okay.
If any of your immediate family has experienced any of the following ever or in the last year, especially. So, any history of hypertension?
Yes, on my mom's side.
Okay, and is this recent?
Yeah, I think she started having issues, maybe 2-3 years ago.
Okay. Okay. Diabetes?
No.
Okay. COPD?
What?
COPD?
Not really sure what that is.
Okay, then no. Asthma?
My brother, yeah.
Okay. All right. Bleeding disorders?
No.
No. Ear or sinus infection?
No.
Okay. Any issues with the heart, kidney, or liver?
Yes. Liver.
Okay. And this is on which side?
My mom.
Okay. Psychological, psychiatric disorders?
No.
Okay. Seizures?
No.
Okay. Sleep disorders?
Sleep apnea on my mom's side as well.
Okay.
She just got very unlucky health-wise.
Just got a little spice in the pot.
Yeah.
How many hours a night do you usually sleep?
Maybe around 8,
Okay.
9. Yeah, I've been sleeping a lot better
Very
too.
good. Okay. Any family history of stroke?
No.
Okay. Major surgeries?
No.
Okay. Thyroid issues?
On my mom's side.
Okay. Any other injuries or issues I should know about?
No, I don't think so.
Okay. When was the last time you had blood work?
I think it's been almost 2 years.
Okay, so I'm going to go ahead and order some blood work for you. Hopefully we can get that in today, but I'll have to check with scheduling.
Okay.
Do you take any medication on a regular basis?
Just multivitamins.
Okay. Do you exercise regularly?
I just started.
Okay. It's always a good time to start. It's
Yeah.
always now. Good. Do you do walking, running, weightlifting?
A little bit of everything, more weightlifting and just like
Nice.
kind of like whole body workouts, a little bit of high intensity as well.
Okay. How many times a week do you do that?
I'm shooting for 6, but
Wow.
sometimes
Okay.
it doesn't
That's a
work out.
lot. To stay on a good schedule, sometimes it's good to start with maybe 1 or 2 days a week just so you don't feel that burnout, but I admire your enthusiasm.
Thank you.
Do you use tobacco or alcohol?
No.
Okay.
Alcohol very rarely, like maybe once a month.
Okay. Any allergies?
No.
All right. Did anything else change in the last year or so?
No. I
Okay.
don't think so.
Great. I'm going to put on some gloves and start with your vitals.
Thank you.
Okay. Start with your heart and lungs.
Okay.
So just breathe normally for me. Okay, very good. Normal sounds. Your heartbeat sounds regular. I'm going to listen on the bell side. All right, no murmurs present. And listen to your lungs now. So just going to be, there we go. Make sure your legs are uncrossed. All right, very good. Okay. Okay. Let me get your blood pressure. How's that feel? Is that too tight?
No, that's good.
Okay, good. Okay. Okay, that's 110/70, so that's really good. I'll take your oxygenation and temperature. Okay, 97.9. Heart rate is 86 beats per minute. Okay, oxygenation is 95 at room air. It's all within the normal range. Okay. All right, I'm gonna palpate your face. I'm just feeling for any bumps. Feeling for swelling and your lymph nodes as well. Preirregulars are non-palpable. And so are your postirregulars. No swelling of the lymph nodes. Any pain when I press here?
No.
Okay. ahead and lower your eyebrows for me and try to raise them in 3, 2, 1. Good. Now raise them as high as you can. Try to lower them. 3, 2, 1. Good. Okay. I'm going to just do some facial myotomes to assess the musculature of your face, make sure everything's working properly. So go ahead and turn to your left. All right. And your right. Okay. Same thing. I'm going to just put my fingers on the bridge of your nose.
Okay.
Good. On the other side. Good. Now try to look up at the ceiling for me. Okay. Just your chin to your chest. Okay. Very good. Puff up your cheeks for me. I'm going to stop you from doing that. Okay. Very good. Okay. Smile for me. Okay. Brown. Okay. Very good. So facial muscles are working very well. No signs of numbness. Okay. Just going to do some percussion. Okay, any pain there?
No.
Okay. I'm just going to palpate your thyroid. Okay. Everything normal. Okay. I'm going to go ahead and take a look at your skin. Okay, close your eyes. It's going to be a bright light. Just want to make sure that your skin texture is healthy. Do you tend to get oily skin, dry skin?
I think pretty normal. Maybe a bit
Okay.
more on the dry side, but
Okay. Your skin looks really healthy. Any skin issues like itching or dandruff?
no.
No. Okay. I'm not seeing anything concerning. Do you use the SPF?
Yeah.
Okay. Very good. I'm gonna look at your eyes and your ears next. Okay. Go ahead, look straight ahead for me. Okay, are people around him reactive? No issues here. Healthy cornea. Optic nerve looks to be very much intact. No yellowing of the eyes or redness. Do you wear contacts or glasses?
Contacts, yeah.
Okay, are they in right now?
Yeah.
Oh, very good. Same here, no issues. Go ahead and blink for me once. Okay, go ahead and look up for me. Look down. And look to your left. To your right. Very good. Okay. This is a Snellen chart. Go ahead, hold it at arm's length.
Okay.
All right, and can you read this third row here?
Yeah, FPH.
Okay, and this row?
The next one?
Sorry, yes.
OLCF.
Good. What about this third to last row?
EPTZO.
Good. And can you read it backwards?
OZTPE.
Okay, and the last row?
LTFPH.
Good. What color is this?
Red.
And what color is this here?
Green.
Good. Which circle is larger, number 6 or number 2?
6.
Okay, number 9 or number 6?
9.
Okay, number 5 or number 2?
5.
Okay, very good. All right, let me know when my fingers enter your field of vision, okay? Say now.
Now.
Good.
Now.
Good.
Now. Now.
Okay. Now let me know when my fingers leave your field of vision.
Now.
Okay.
Now. Now.
All right, good. Now let me know which fingers that you see moving, the ones on your left or your right.
Okay. Left. Left. Right. Right. Left. Right. Both. Both.
Very good.
Both.
Okay, excellent. All right, go ahead and follow the light for me.
Okay.
Okay, go ahead and follow my fingers. Okay, excellent. I'm going to go ahead and look at your ears next. Look straight ahead. Okay. Tympanic membrane is gray and intact. Okay. I'm seeing a little bit of wax build up. Do you mind if I clean a little bit in your ear just to get that out of the way so I can better visualize what's going on? Okay. Do you have any hearing issues? Okay. Just going to tuck your hair back a little bit here. Okay. Okay. Not too much wax in there, but I just wanted to make sure. Alright, I can better visualize the membrane. No scarring, scratching, or signs of infection. No signs of prior damage. Yeah, your ear looks perfect. Let me go ahead and look at the other one. Okay. Same thing here, just a little bit less wax, but it's still kind of obstructing the canal, so I like to just do some very light cleaning. I think that it's going to help you hear better as well. Okay. 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 Okay, gonna go ahead and take another look. Alright, same thing here. Your ear canal's very healthy. No scarring. It's pearl gray. No purpling of the skin. Your circulation looks very good. So I think we'll move on to just some basic hearing tests and then we'll move on. Okay. I'm going to take this tuning fork and just making vibrational sounds just underneath the ear and different places of the sections around the ear. Okay. Let me know when the sound and vibration stops, and if you don't hear it at all, let me know that as well. Okay.
It stopped. Stop. Stop. Stop.
Okay.
Stop.
Okay. And using a different tuning fork, let me know which sound is louder, A or B. Keep your eyes closed. This is A. This is B.
A.
Sorry, that was a little loud.
Yeah.
A or B?
Which one was A? Which one was B?
A. B?
B.
Okay. A or B?
A.
Okay. Let me know if the sound is coming from beneath your head or above it.
Okay. Below.
Okay.
Above. Below.
Okay.
Above.
Okay. Very good. And next I'm going to make some rustling sounds. Let me know if you hear it on your right or your left ear, okay?
Left.
Okay.
Right. Left. Right. Left. Right.
Okay. All right. I'm going to test your taste now. So just going to be placing a paper in your mouth. Just taste it for a moment and open and let me know kind of what that tastes like. You don't have to get it perfect, but just a general sense.
Okay.
So open, close, open.
It's a little bit better.
Yes, very good. Okay. Open, close, open.
Doesn't really taste like anything.
Okay, that was control paper. So, good. And one last one. Okay.
Doesn't really taste either.
Okay. That was sweet, so I'll just make a note. Okay. All right. Just have a few aromas for you to smell. Close your eyes and let me know kind of what this smells like.
Okay. It's like aroma.
herbal in a way, but
Yes.
I cannot really pinpoint what it is.
Chamomile.
Okay.
Yeah, so no problems there. Go ahead and inhale.
Tastes like wood varnish or something.
Cedar.
Okay.
Yes. Good job. Yeah. And one more. This one should be pretty straightforward.
Cherry?
Cinnamon.
Okay.
Yeah. So, no. But I can kind of see where you will get cherry from that.
It just smells really sweet.
Mm-hmm.
So.
Very sweet. Okay. And we're gonna move on to your scalp and abdomen, but first I just want to do a couple of quick sensory tests to the face.
Okay.
I know that we felt the muscles and palpated, but this is just to make sure there's no neurological issues like numbness. Okay, so this is going to be a soft sensation. This will be sharp. Let me know which one you feel, okay?
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull.
Okay, I'm going to have you lay down so I can look at your hairline. Then we'll move on to your abdomen and feet, okay? Okay, I'm just going to take a section of the hair and take a look at your hairline and scalp. Sometimes, even though the base on our skin is very healthy, we can miss sun damage and other issues like dermatitis, dandruff, cellulitis, issues like that. So on initial inspection, your scalp looks pretty good. I'm just going to check here. Do you have any issues with itching?
I noticed maybe like a month ago, right after I dyed my hair, it was a little bit itchy, but then it just went away.
Okay, that was probably a reaction to the chemicals. And if it went away, then that would be normal. I'm not seeing any flaking. Okay. Any pain here when I press? Okay, pain here. All right. Just gonna feel the scalp, just to feel if there's any bumps or areas that would be of concern to me. No swelling. I don't know if there's any areas with pain. I'm seeing a couple of moles. They look to be in the same areas that we measured last time, if my memory serves me correctly. But I'm just going to do a couple measurements to make sure there's been no growth or change in size or symmetry. Okay. Okay, just one light spot here. That is 0.5 by 0.5 centimeters, symmetric in shape. Okay. I noticed I have a little tiny Cheryangioma right by the forehead. That looks to be new, but they're very common and normal. Okay, it's 0.3 centimeters, symmetric in shape, and the standard red color. Okay, now we have a little bit larger one here that's 0.5 centimeter, symmetric. I don't think it's raised. I'm just going to feel the texture with the tool to be sure. So just hold still. Okay. It is flush with the skin, so that's good. Okay. Okay. You're going to feel a puff of air along the scalp. Let me know if you feel it once, twice, or 3 times, okay?
Okay. Once. Twice. Once. Twice. 3 times.
Okay.
Once. Twice. Once. Twice. 4.
Good.
1. 1.
Okay, just visualizing different sections of the part. Your scalp looks to be very healthy. Do you use SPF on your head?
No.
Okay. How often do you spend in the sun?
Don't really like being in the sun. It always gives me a headache.
Okay, so probably not an issue for you. It's always good to remind my patients to wear hats, or there are certain SPF sprays that are meant just for the hair and scalp that can protect you from sun damage, but I'm not seeing any major issues here. A couple tiny sunspots, but everybody has those. Okay. So take a little strand of hair and look at the follicular health. Okay. Your hair seems to be very healthy. I'm not seeing thinning of the hair. The moisture level of your hair is very normal, which suggests that you're hydrating very well and that your diet is very good. If your hair was overly dry or oily, it would be cause for concern. But your hair seems very good. How often do you wash your hair?
Every other day usually.
Okay, that's perfect. Okay. I'm going to take one more look here. Okay. There's no damage that I see. So I'm going to move on to your abdomen. I'm just going to palpate and listen for normal sounds, okay? And then we'll move on to the feet and be finished. But so far you're in perfect shape. Okay, so I'm just going to be listening to your stomach to listen for normal acidity buildup and making sure there's no abnormal regurgitation sounds. Do you have any digestive issues?
No, not usually.
Okay. Okay. Everything sounds normal. I'm going to do some palpations to make sure your organs are proper in size. So you're going to feel a little pressure. Okay, feeling your diaphragm. Take a deep breath in for me and relax. Good. Okay. All right, everything feels good. I'm going to move on to look at your feet, and then we'll be finished. I'm going to just take off your socks and inspect the feet. Okay. Okay, I don't see any dryness. It's normal to be a little drier on the feet, but I'm seeing that you take very good care of yours. Do you moisturize regularly?
What?
Do you moisturize regularly?
I probably should do more of that.
Oh, it looks very good. Okay, no issues here. I'm going to do some foot myotomes. Try to lift your legs for me. Okay, good. Now lift them in the air, just slightly. Okay, try to lower them for me. Good, very strong. I'm going to press back against the pads of your feet. Press against me. Good. Now lift your legs up towards yourself. Good. Now try to spread your legs. Okay, now try to bring them in. Very good. Going to do a Lipinski response test. Okay, very much intact. Okay, very good. I'm going to take a sample here. Okay. I'm doing some measurements for symmetry. 6 here, 5.5. Okay. Okay. Excellent. All right. I'm going to place the vibration on your feet. Let me know when it stops, okay?
Okay. Now. 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 Now.
Okay. Let's go ahead and sit up and discuss the results, but I think you're very good. Ivy, so we went over everything. You're in perfect health. The only thing that was out of normality was you got one of the taste tests wrong. It was sweet. You didn't taste anything, but just given the level of accuracy with your other cranial nerve tests and your smell, I don't think there's an issue there. You're healthy. You're good to go for another year. All your vitals were great. Okay. It was wonderful to see you.
You too.
Thank you for coming
Thank you.
in. I hope you come in more often. It was great to see you.
You too. Thank you, Dr.
All right.
Gay.
And we'll see you next year, okay?
Okay.
Bye.
Bye.
Hi, Matty. How are you?
I've been a little bit better.
Okay. Tell me what's going on.
I'm having some knee pain.
Okay.
It's really hard to walk.
Is it this right knee here?
Yes.
Okay. When did that begin?
I would say about a month ago.
Okay. Do you remember spraining it or any issue that might have provoked this?
Hard to tell. Being so busy all the time and running around, I just didn't pay attention. Then one afternoon I noticed that I'm limping.
Okay. All right. Do you exercise?
I do, yeah.
Okay. And how's exercise been since this injury happened?
Very hard. Upper body, and that's it.
Okay. Have you taken any rest?
Yeah.
Okay. Good. So I would completely rest that knee to the foot until we find out what's going on, okay?
Yes.
Great. So are you wearing any new shoes?
No, same shoes.
Okay. So it would not be an issue with shoes. Is it like a numb? Do you ever feel numb or tingly?
Pain.
Okay, so just pain. Does it radiate?
It does, kind of like towards the back of the knee.
Okay, so it's mostly in the back?
Yeah.
All right. And on a scale of 1 to 10, how bad is it right now?
About 4.
It's about a 4. Okay. And how bad is it when it gets at its worst?
8.
Okay. And is it worse at any time of day?
No, it's just worse. Like even at night, it wakes me up.
Okay. Do you have any allergies to medications?
Penicillin.
Okay. Okay. Any other changes in lifestyle in the last month? Did you travel? Anything like
No.
that? No? Okay. Well, I'm going to go ahead and take your vitals since it's been a while since I've seen you. And then I'll look at your knee joints and also your feet as well. Okay. Okay. So, start with your blood pressure. Can I use this arm?
Yes.
Right. Okay, that's 110/62, so completely normal. I'm gonna slide this off. Okay. Listen to your heart and your lungs next. Just breathe normally for me for now. Okay. All right, only as one has to be present. Listen on the bell side for murmurs. Very healthy sounds, no murmurs present. Listen to your lungs, if you don't mind just moving your arms a little bit. All right, take a deep breath in and out. Good. Deep breath in and out. All right, listen on the other side. Deep breath in and out. Deep breath in and out. Okay, sounds are normal. I'm going to grab your oxygenation. I could have your index finger. Make sure your legs aren't crossed. Okay. That is, heart rate is 87 beats per minute. Oxygenation is 94% at room air. So a little bit lower than what I'd like to see. And take your temperature. Okay. That is 97.9. Normal. All right, go ahead and look at me and let me know when the light enters your field of vision.
Now.
Okay.
No. 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 No.
Okay, good. Okay, now keep your head completely still and follow the light for me. Okay, very good. Any dizziness that you're experiencing along with this?
Yeah.
Okay, when does that occur?
What do you mean?
Dizziness?
When does it occur
Yeah.
in general?
Mm-hmm.
Oh, I had some dizziness now. That's what I meant to
Oh,
say.
oh, so just now, but not in general.
No, I've never experienced that before.
Okay, that's a good thing. Okay. So I'm going to go ahead and move on to your feet, to your knees and your feet, okay? So you can just stay right where you are. Okay. So first I'm going to do some simple movements with your knees and listen to how the joints are behaving.
Okay.
Listening for any creaking or popping. Okay. So you don't have to do anything on your own, just okay. Okay, now it's the left knee that you mostly have problems with, but this knee is sounding healthy, so that's a good sign. Alright, now I'm going to ask you to do some movements on your own. If you could lift and lower your legs slowly, just this one, just this one. Okay, as high as I can go. Go ahead and lower. Okay, good. And move it slightly to the left. Okay, and slightly to the right. Okay, very good. Now if you can move your knee up. Okay, and down. All right, any pain doing that?
No.
Okay, very good. I'm going to go ahead and write that down. All right, I'm going to grab a pair of gloves so I can just palpate the area. Okay. All right, I'm feeling healthy. Joints and the tendons between the joints seem to be firmly in place. No dissension of the lower kneecap. A slight protrusion here. On the lower quadrant. But it does seem to be symmetric, so could be just the way that your bones are aligned. Okay, go ahead and just raise your foot. I'm just going to feel underneath here. Okay, and no pain on this knee when I do those motions? No. Okay. Okay. I'm going to go ahead and look at the feet now. Okay. Just palpating here. Okay, wiggle all your toes at once. Okay. Try to lift your big toe. Okay, go against my push. On your next toe, go ahead and try to lift it. Okay, third toe, fourth toe, fifth. Okay. A little bit of atrophy here, but that's pretty normal in the sitting position. Go ahead and try to push this leg out towards me. Okay, now try to bend it back. Good. Now try to bring it in towards yourself. Okay, now pushing it outwards. All right. I'm going to listen to your ankles now. Okay, go ahead and roll your ankles. Okay. Okay, keep going. Sounds are normal. Okay, let's do it again. Alright, you can go ahead and rest that. Okay, I'm going to be looking at the feet more in depth later. But for now, just visually, your feet seem normal. No lumps, bumps, things to worry about. Symmetric in appearance, but I'll be measuring them a little here in a little bit. I'm going to move on to your problem knee. Okay. hearing a lot of noises I don't like. Sounds like the joints are very inflamed. I feel also hearing a throbbing, which means there's a lot of pressure and blood flow pulsating in the area, which means that it's under some stress. Especially in this area. Just going to palpate. Does it feel painful when I touch this part?
Yes.
Sorry.
That's okay.
Painful here beneath the knee?
Yes.
Okay. Go ahead and try to lift your knee in the air. Go against my push. Your right knee only. Good. A little bit weaker than the left. Try to bring it in towards yourself. And outwards. Okay. I'm going to raise your leg in the air. Try to lower it. Now try to raise it in the air. Okay. Definitely seeing some swelling here. Okay. I'm seeing that perhaps the knee became misaligned when you were exercising, perhaps. It seems it's very disconnected. The higher part of the calf is detached from the lower section. The tendons are still attached, so it doesn't seem like an issue that would be a broken knee, but you do need a lot of rest and therapy, so I'm going to look at the general appearance of the knee. Okay. Some redness here, but that's what I expected to see. Okay. Going to do some measurements here. Okay. Go ahead and lift this knee just very slightly. I'm just comparing symmetry to the other knee. Go ahead and lift that. Okay. And measuring the bottom of the kneecap all the way down to the ankle. Okay. Okay. So there's a little bit of variance here. This one. To the midsection, which goes a little lower. And seeing some asymmetry. Okay. Okay. That's 8 and 8. So the left knee is definitely more symmetric and uniform in shape than the right knee. Okay, go ahead and keep your eyes closed, and I'm going to be touching one of your knees with an object. Let me know if you feel the sensation on your left or your right knee, okay?
Right. Left. Left. Right. Right. Right.
Okay. I'm going to be drawing it all the way down from your knee to your ankle. Let me know if you feel it all the way.
Yes.
Okay.
Yes. 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 Yes.
Okay. And I'm going to be doing a motion once, twice, or 3 times. Say 1, 2, or 3.
2. 3. 2. 1. 1. 3. 1. 1. 2. 1. 1. 1.
Okay. So those are just some basic sensory tests. You passed them, so you're not having any neurological issues with your knee. I'm going to have you lay down so I can take a better look at your feet and also do some movements of the knee to see if we can get it feeling better. Okay? I'm going to take an initial look here with the pen light. Looking at the skin surface can tell us a lot about what's going on underneath in terms of inflammation. Okay. Not seeing any purpling or redness. No significant swelling. No steatosis. If you look clean and healthy, don't see any lesions, warts, no fungus. So it's a good place to start. Okay. Checking for any debris or moisture that may build up at the tip of this tongue depressor. Do you ever have excessive sweating of the feet?
Sometimes, yeah, especially in the morning.
In the morning, do you wake up with very sweaty feet?
No.
So after you wake up?
Yeah.
Okay. And seeing some moisture build up and just a little bit of clamminess here. Okay. Not so much on the top. Okay. And definitely some more sweating on that left side. Doing a moisture reading. Okay. Actually, this is normal levels. Let's try the other foot. Okay. So the left foot is a little bit higher in moisture. Usually it's best to have both sides symmetric in this quality. So I'm just going to take note of that. I'm going to apply an antiseptic spray, an ointment for the body that's going to help decrease any swelling and moisture that you're having down there. And it just helps with general inflammation. That's because I'm seeing some of this inflammation of the rise in muscle mass and some swelling right in the forefoot beneath the beginning of the metatarsals. So I'm just trying to really make sure that we take care of that. Okay. I'm going to be mixing it in with some other ointment just for sore muscles. And mixing it with the other leg, the other foot, I mean. Okay. I'm going to do some measurements to see if the symmetry is a little bit better. A little bit. Yep. Okay. Okay. I'm pretty pleased with these results so far. Just gonna see here. The skin seems even and elastic. Okay. going to apply some pressure point therapy before I move on to just some very gentle knee adjustments. Okay. This helps to circulate blood flow. Okay. Next I'm going to do a gentle knee adjustment, and we'll go ahead and talk about how that went for you. Okay. So I'm going to be lifting your right knee. Go ahead and place it here. I'm just going to be stretching it. Okay. I'm doing some very light rotations. Okay. All right, go ahead and lift this one. Doing some rotations again. Very gentle. All right, and lastly, I'll just be doing some pressure point therapy to the knee area. think this concludes our exam. Do you have any questions?
No,
How did he feel?
it feels a little bit better.
That's really good. Hi, Ezra.
Hi, how are you?
I'm very good. So, this is your first time coming in to see me.
That's right. And you're Dr. Katie, right?
Yes, sir. I'm Dr. Katie.
It's nice to meet you.
Yes. So before I just go over your family history and questions like that, do you have any concerns today that you'd like me to focus on?
Yeah, I'm experiencing some shoulder pain and some neck pain for sure. And then when I wake up in the morning, my stomach really hurts, and so I'm not sure what's going on with
so
that.
Sorry to hear that.
It's okay.
Okay. And so you're having some abdominal pain. What kind of pain is it? Is it a muscle soreness, or do you think it's more internal?
It's like a sharp
A
pain.
sharp
I
pain?
would say. Yeah.
Okay. And you said it's when you wake up in the morning?
That's right.
Any other time of day?
No, really, just in the morning.
In the morning, okay. Do you eat anything before you go to sleep, or anything in particular?
Not usually. I'll drink a lot of water before bed.
Okay. What do you describe it as? Nausea?
It can make me nauseous. Yeah, it makes
Okay.
it very hard to eat breakfast.
Okay. And how long does it last usually?
About an hour or two.
Okay, and then it kind of goes away.
Mm-hmm.
Okay. All right. And for the shoulder pain, did you do anything that you can remember that might have caused it, like falling or exercising with a lot of strain?
I do fall off my skateboard a lot.
Okay.
So I think there might be something to that.
That
I may
could
be
have been.
falling wrong.
Mm-hmm. And which shoulder is it?
It's my left
Your left shoulder. And is that persistent throughout the day?
It's made it hard to lift things very well.
Okay. And so on a scale of 1 to 10, how would you rate that?
I would say it's probably like a 6.
Okay.
Not super painful, but uncomfortable.
Okay, kind of like a soreness, like something feels off whack.
Yeah.
I'm very happy to look into that. So I'm going to ask you just a few preliminary questions since it's our first time seeing each other. Do you have any allergies to medications?
Any allergies to medications? Penicillin.
Penicillin, okay. Any surgeries in the last 12 months?
No.
No. Okay. Did you travel out of the country in the last 12 months?
I have actually.
Okay.
Yeah.
And where did you go?
I went to Mexico.
Oh, nice. Okay. Any flu-like symptoms upon returning?
No.
Okay. And you're up to date with all your vaccines. You have your vaccines and everything. Great. Okay. Any family history of high blood pressure?
No, not that I can recall.
No. Hypertension? Okay. Blood or lung disorders? Okay. And have you been hospitalized in the last year?
No, I haven't.
Okay, very good. And so other than your stomach and your shoulder pain, do you feel in pretty good health?
Absolutely. Yeah.
Great. What's your diet like? Do you follow any special diets or?
No, I honestly eat everything.
Great. And it's causing you no problems?
No,
Very good. Do you drink coffee?
I don't drink coffee. I drink decaf.
Lovely. And are you on any medications?
No,
Okay. Okay. I'm going to go ahead and get your vitals. I'm going to listen to your heart and your lungs. Then I'm going to just do a quick cranial nerve assessment before I focus on your abdomen and your shoulder. Okay?
Okay.
All right. Okay. So go ahead, breathe normally for me. Okay. Sounds are normal. And listen on the bell side. Okay, no murmurs. Very good. Okay, and one deep breath here and listen to your lungs. Excellent. And on the other side. Okay. Very pleased with that. I'm going to look at your oxygenation and heart rate. So give me your index finger and make sure your legs are uncrossed. Thank you. Okay. Okay. Normal temperature. You're at 97.3. Okay. Your heart rate is 57 beats per minute. It's a little bit low. Oxygenation is excellent. 99% abdomen air. So, thank you. And next I'll grab your blood pressure. Do you have an arm preference?
This please.
Okay. Okay. Okay, that's perfect. It's 110/76. Okay. Okay. I'm going to be doing some facial palpations just to make sure your lymph nodes are normal in size and that the musculature of your face is normal. Okay, so very good. Okay, gonna feel your thyroid gland right here. That's normal in size. Gonna be just palpating the face very gently. Everything feels normal. Feeling for lumps or bumps in the cranium. Okay. I'm going to do a few tests to gauge your muscular response of your face. So brown for me with only your eyebrows. Okay, now try to raise them in 3, 2, 1. Good. Now raise them as high as you can go. Try to lower your eyebrows. 3, 2, 1. Good. Now puff up your cheeks for me. I'm going to try to close them. Don't let me do that. Very good. Okay. Now smile for me. Show me all your teeth. Brown. Good. Very good. I'm going to place my finger gently here on the side of your face. Try to go against my push. Okay. In 3, 2, 1. Good. Other way. 3, 2, 1. Good. Now try to look up at the ceiling for me. I'm going to resist your pressure. Let's try to bend your head up. Good. I'll try to touch your chin to your chest. Very good. You can put your arms out just like that for me. All right. Try to spread them apart. Good. Try to bring them together. Okay. Try to raise them up to the ceiling. Good. Try to lower them to the floor. Very good. All right. Okay. Go ahead and close your eyes for me. Do you feel the difference between sensation 1 and sensation 2?
Yes.
Okay, good. I'm going to bring sensation 1 from the top of your base all the way down. Let me know if you feel it all the way, okay?
Yes.
Okay, and did it become numb at any point? All right, good. This is a soft sensation. This is sharp. Go ahead and say soft or sharp.
Soft.
Good.
Sharp. Soft. Sharp. 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 Soft. 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 Sharp. Sharp. Soft. 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 Soft again.
Good. This will be 1 pressure point. This will be 2. Go ahead and say 1 or 2 and keep your eyes closed.
1, 2, 1, 2, 1, 1, 1, 2, 1, 2, 1.
Very good. I'm going to be doing a taste test. So I have some testing paper. These are just strips. And I want you to let me know what they taste like. So
Okay.
go ahead and open, close, open. What that tastes like to you?
Sour.
Very good. And this one, open, close, open. What did that taste like to you?
Sweet.
Very good. All right. Okay, so go ahead and close your eyes and inhale and let me know what this smells like.
Ooh, it's bright and citrusy, maybe lemongrass.
It's lemon. Perfect. Okay. This next one might be a little bit more difficult.
Eucalyptus?
Rosemary, but
Wow.
in the same family. Okay, and this next one should be pretty strong.
Ooh, is that like, can I smell it one more time?
Yeah.
It's kind of like warm and it's like a warm, dark smell, like maybe frankincense or sandalwood. Or
It's cedar, so you got the
Cedar.
wood right. Yeah. So all these are in correct range, so I'm not worried. I'll give you one more, and it's kind of eucalyptus-y, but not quite.
Can I smell one more time?
Yeah.
Is it sage?
It's tea tree.
Tea tree.
Very medical test I'm giving you right now. Yes, tea tree. So, but I'm not worried. You got it all in the right kind of frame. So,
Thank you.
all right, go ahead and look straight ahead for me. Okay, look to your left, look to your right, and up and down. Perfect. Your pupils are round and reactive to light. I'm not seeing any excess veinage, jaundice. Corneas look very healthy and intact. So, we'll look here. Very good. Same here. Look up, look down, to your left, to your right. Very good. Do you wear contacts or glasses? Okay. When's the last time you had an eye exam?
6 months ago.
Okay. All right, so you should be good to go then. I want you to let me know when my fingers enter your field of vision. So find like a point on the wall, look straight ahead, and let me know when you see them.
I see them. I see them. I see them. I see them.
Very good. Let me know which fingers are moving, my left or my right.
Both.
Right. Good.
Left.
Okay.
Right. Left.
Okay, very good. And can you hold this Snellen chart for me at arm's length? Very good. Can you read this third row here?
F, P, H.
Yes. And what about this row?
D, H, J, B, S.
Okay, and then the last row.
L, T, F, P, H.
Good. And can you read it backwards?
H, P, F, T, L.
Excellent. And then what color is this to you?
Green.
What color is this?
Yellow.
Great. What circle is larger, number 8 or number 4?
8.
Number 4 and number 2?
4.
Okay, number 2 or number 9?
8. Sorry.
Number 2 or number 9?
9.
Good. All right. So your eyes seem very healthy to me. No issues with watering or dryness. Okay, we'll move on to your ears. All right, go ahead and look straight ahead for me. Okay. Your tympanic membrane is pearl gray. You have a little bit of wax buildup, but not too much to obstruct my vision of the membrane, so very good. No issues here. Any problems with hearing? No? Okay. Oh.
I wear earplugs to go to concerts.
Oh, you do. That's very responsible of you. Thank you. I'm very glad to hear that. Yeah. Go ahead and look straight. It's a cute earring that you have.
Thank you.
Okay. Nice and pearl gray. No scratching or scarring. No signs of infection. Okay. I'm going to do a couple of tests with the tuning fork.
Yes.
Okay. So I want you to let me know which sound is louder, A or B. And I'll just use this. Okay. This is A. This is B.
Okay.
Okay. So go ahead and close your eyes and let me know which one is louder to you. A.
A.
B. A. Okay. A or B.
A.
Okay, good. I'm going to be placing the tuning fork directly under your ear. Let me know if you hear and feel a vibration or a pressure.
Pressure. Vibration.
Good.
Vibration. Pressure.
Good. I'm going to be doing it to different areas of the skull as well.
Pressure. Vibration. Pressure. Vibration.
Good. I'm going to be making a rustling sound, and let me know if you hear it on your left or your right side.
Left. Right. Left. Left. Right.
Okay. And do you hear it from above or below your head?
Below. Above. Below. Left.
Okay, good. Okay, so I'm pretty happy with your cranial nerve exam. Your hearing is intact. Your vision is, taste and smell are all good. And I'm not seeing any signs of numbness. So I'm going to go ahead and move on to assess your abdomen right now. I'm going to have you lay down in the bed and get comfortable. And I'm just going to listen and palpate, okay?
Thank you.
Okay, Ezra, so I'm going to start just by listening to the sounds of your stomach. See if there's any acid buildup or any regurgitation sounds that I can identify. So would be abnormal. So just breathe normally, relax. Sounds are normal. Sorry, it's a little cool to the touch. Do you mind if I lift your shirt just a little bit so I can better visualize? Okay, there we go. Okay. I'm not hearing any acidic disturbances of the stomach. Everything sounds pretty healthy. I'm going to do some percussions and also palpate as well. So this is just to check for edema to see if you're swollen. I don't see any visual swelling, so that's good. Okay. I'm going to test to make sure that the temperature is normal. Okay. I'm going to just palpate your stomach just to feel the size and structure of the organs.
Thank you.
Okay. Okay. Liver is normal in size. Spleen and diaphragm are normal. They're in the right place. No dissension of the lungs. And when I pressed down there, did you feel any pain?
Not that much, no.
Okay.
A little discomfort, but
A little.
it felt normal.
Mm-hmm. Okay. All right. Just going to measure the stomach, just different regions to make sure that there's no part of the stomach that has specific edema. Okay, just to make sure that there's nothing I missed. So we're just looking for symmetry here. It's 15 centimeters. And that is symmetric on the right and left side. Okay, space between the lungs. 19. Okay. 18 here. Okay, take a deep breath in and deep breath out. Very normal. Okay. 33 centimeters, and it's symmetric on both sides. Okay. 24 to the chest. Do you consume dairy as part of your diet?
Yeah.
Okay. Might be something to look at.
I actually do have a glass of milk right when I wake up.
Okay.
So maybe that I should try not doing that sometime.
Very much could have to do with your stomach pain. It's worth a try. Not everything is due to lactose intolerance. I feel like dairy products have been demonized a lot in our culture, but there is some truth to, as we get older, sometimes our body develops intolerances to things like dairy, gluten. So if you want to try to cut the glass of milk in the morning and maybe have some almond milk, oat milk, is a very good alternative.
I'll give that a try sometime.
Just to try, yeah. The good thing is I'm not noticing anything physical, like enlarged organs, hardened organs. One side of your stomach isn't asymmetric to the other, so that is ruling out any major intestinal problems.
That's good to hear.
So I think you might be experiencing maybe a dietary disturbance.
Okay.
Yeah.
I'll take a look at that for sure. Thank you, doctor.
Yes. So I'm just going to get your hair out of your way, out of my way, so I can take a look at your shoulder.
Okay.
I'm going to just clip it up. Okay, does that feel comfortable?
Yeah, that's
Okay.
nice.
And so, I'm sorry, you said it was your left shoulder? Or?
Yes, that's right.
Okay. So I'm just going to be palpating and seeing if I notice any protrusions.
Oh, yeah, that feels strange.
Okay, and on this side?
That's right.
Okay. Would you describe that as like a dull pain or sharp, or was it just
It's like all around.
all around? It just kind of radiates?
Yeah,
whenever
it's a
I press?
radiation pain.
Okay, so these are your deltoid muscles
Mm.
and going into your trapezius muscles. So definitely some kind of injury sustaining there.
Mm.
I'm noticing some tightness in that area and actually like a big knot right here.
Oh, wow.
So
Yeah, I feel that too.
it's frustrating, but a good sign because that means we can probably rule out a neurological problem. And that you really probably did just pull a muscle. But I'm going to listen just to. Okay. I want you to do a simple movement for me, just to roll your shoulder back. I just want to notice any clicking or popping. Okay. No clicking or popping, so I don't think there's any issue of displacement. No. Yeah, the muscle seems to be intact. He didn't dislodge anything.
It definitely feels more sore than it did yesterday.
What?
It definitely feels more sore than it did yesterday.
Oh, okay. All right, so it is kind of getting worse. Do you exercise?
I do, yeah.
Okay.
But I fell off of my skateboard like 2 or 3 days ago.
That's right. Okay. So that's probably an injury from that. Were you having any pain before you fell?
No, I was feeling great that day.
Okay. I'm going to do some tests to make sure you're not having numbness, but yeah, and then I think I can apply just a couple of rudimentary massage techniques that's going to help that out.
Okay, thank you so much.
Okay, so we're just going to do a sharp or dull test. This is a dull sensation. This is sharp. Do you kind of feel the difference?
Yes.
Okay. Go ahead and say sharp or dull.
Dull.
Good.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. 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 Sharp.
Okay. I'm going to do some brief might home exercises. This might cause some strain. If you feel any really sharp pain, please stop. But I just want to see if you're able to do basic movements. So I want you to shrug your shoulders. I'm going to resist your movement. Good. Okay. So now with this shoulder blade, I want you to push back against my hand like you're twisting your upper torso towards me. Good. Okay, let's see the other side. Okay, and now bring that side back towards me, pushing against my hand. Okay, good. Now try to twist your body to the left. Okay, now to the right. Okay, so that seems normal. I'm seeing good symmetry along the musculature here, palpating the cervical spine. Okay, I'm not noticing any deviations, no signs of scoliosis or lordosis. Okay. Okay. Do you feel the sensory brush on your right or your left side?
Left. Right. Left. Right. Left. Right. Left. Left. Right. Center.
Good. Okay. And just to loosen the muscle tension, I'm going to be doing a tapping therapy. So you're just going to feel a light tapping pressure. Do you feel that?
Yes.
Okay. Is it painful?
No.
Okay, good. So I'm going to be applying a targeted pressure to that area where I noticed the knotting. Okay. Okay. So and I'm just going to apply just a ball rolling massage technique here. Using some oil. I'm just kind of evening it out on the other side. Do you feel kind of a better release of tension here?
Yeah, I do.
A little bit, okay.
That's helping a lot.
Oh, good. I'm glad to hear. And actually, I do have an electric massage that might kind of feel good.
Yeah, that's helping so much.
Good. It's just good to apply pressure to the area in whatever light way you can, in a way that's safe to release that tension. It's really going to help you heal faster. Now you might be a little bit red in that upper left area in the next couple of days, and that's normal. It just means that there's been some cellular work done. All right. So as long as those techniques that I applied, did that make your back feel better or worse?
Much better.
Okay, good. Then I think you did just pull a muscle. Go ahead and turn around and we can just talk about the results. Okay, Ezra, so other than your stomach issue and your shoulder, which I think we kind of explored in depth, you're doing very healthy. Your vitals are great, eyes, ears. I didn't notice any alarming signs that would be reason to get imaging on your stomach or shoulder. Your organs felt normal. I didn't notice any neurological issues. You responded well to all the sensory tests. So I'm going to go ahead and prescribe rest for your shoulder. If you could give a week off of exercise and skateboarding, as hard as that may be, because the weather is so great, then that would probably aid in healing a lot faster. Try to cut out the glass of milk in the morning, replace it with something else. There are a lot of alternatives to milk that are dairy-free on the market right now. And I'll call you in about a week and we'll see how you feel from there, okay?
Okay. Thank you so much, Dr. Katie. I appreciate your help.
Yeah. Do you have any questions?
Not at this time, no.
Okay, all right, great. Well, if you do, just give me a call and I'll look forward to seeing you next year.
Okay, thank you so much, Dr. Katie. Thank you.
Bye.
Bye.